My name's Billie Giles-Corti. I would like to welcome you here to this session this morning, and thanks so much for coming. I just want to see if we can get the slides up, please. Oops. Hello, the slide. Yeah, thank you. Right. Ooh, how do I get rid of that? I see the slides here. Oh, there we go. Great. There's a Oh dear. I don't know what this says. Do you speak Spanish?
Someone's saving.
There's a sign, there's something on here. Should I press that? I don't want to.
Yeah,
Wasn't
I think
sure.
so. I don't know.
All right.
There you go.
I didn't want to. Yeah, I can't read Spanish, so it's going to be tricky.
Check if it's this or this, but this one's.
This is the one. Yeah, yeah. Okay. Thank you for coming. We're going to be giving you. Yesterday, I gave an overview of the Lancet series, and what I'm going to do we're going to do this morning is I'm going to introduce my co-authors, who will give you much more detail about how we went about doing the series. I was the lead author of the first paper, which we called What Gets Measured Gets Done, and I'd like to acknowledge all my co-authors who contributed to this paper. What I mentioned yesterday that what we had done in 2016 had published a Lancet series on urban design, transport and health, and we developed a conceptual framework about the way city planning affects humans' health. And what we said is if we wanted to address the downstream, chronic disease, road trauma, heat island effects, what we needed to be doing is thinking about the upstream determinants of that, the causes of the causes. And what we proposed was a set of city planning indicators related to the eight urban systems that work together to create 8 urban and transport planning and design interventions. And what's important about this is actually to remember this. What we're saying is that it's not about picking and choosing one or other of these. These all work together and have to be implemented in unison. And the urban system policies need to work together in an integrated way to deliver these 8 interrelated interventions. The problem will be is, and as Mark Neuenhausen often points out to me, is that Barcelona, for example, has fantastic urban form, but because they haven't done demand management in terms of traffic, then we have air pollution problems, noise problems that are really increasing, having a major health impact. So it's not about choosing just getting the urban design right. It is about all the other things: demand management, the distribution of employment, whether people can reduce the amount of commuting, obviously good regional public transport so people don't have to use cars all the time. So it's just not about the urban design, it's about all of these things working together. And that's a big ask for cities. Some cities get it right. But what we said was these needed to work together. Now, what we proposed was that what will get measured will get done, and that we should have policy indicators that will tell us about the policy environment, asking the question, do we have the policies in place to deliver healthy and sustainable cities? And then we needed to think about the spatial indicators that are needed to tell us about the lived experience. Do people in cities have equal access to amenities within their cities that can help them live healthy and sustainable lifestyles? So it was 2 lots of indicators that we thought was necessary. Now, as I mentioned yesterday, this wasn't possible to do this. Well, you could, I suppose, these days with the quality of the data that's available, do this sitting in your office. We didn't think that that was the way to go. What we did was established a global healthy and sustainable city indicators collaboration. And here are the countries or the cities that we've been able to recruit. We recruited 80 collaborators, 25 cities, 19 countries, 6 continents. And we wanted to have people on the ground because we believe that by having people on the ground, it would help us ground truth the evidence. It would help us collect the data, ground truth the data, make sure we had good quality data to validate. And also it would allow us then to be able to provide that data back to policymakers in order to be able to change cities, not just to collect data and get publications. We wanted to go a step further than that. Now, we asked a number of questions we wanted to go for a second series. So when we went to a conference, started recruiting people, we said, please join us to create this collaboration. This is what we want to do. And we will go back to the Lancet. The Lancet said they would consider a second series. And then, of course, when we put it together, we did get a second series, but the goal of the second series was really to facilitate a global surveillance system of policy and spatial indicators. What we asked ourselves in doing this is, it seemed like a good idea, but is it actually feasible to measure policies in cities worldwide? We didn't know that that was possible. And if so, do cities have the policies in place to deliver healthy and sustainable cities? Now, we wanted to know, I do a lot of work with policymakers. They don't have evidence-informed thresholds, but we asked ourselves, are there thresholds for urban design and transport features to achieve healthy and sustainable lifestyles? And this is important because we can give feedback back to policymakers in terms of changing the standards that build cities. And the next question was, is it feasible to measure consistently using common data, open data, to measure spatial indicators of urban design and transport features worldwide? Now, that was a big question because we didn't know what the quality of the data would be like. If so, are there inequities in cities? And then we wanted to say, well, what next? We wanted to put a challenge out to all the fields to say, in health fields, what next do we need to be thinking about in terms of healthy and sustainable cities? So I'm going to introduce now Deepti Adlakha. She's an associate professor and director of the National Learning Institute in North Carolina State University. And she co-led the first paper, which asked the question, do we have the policies in place to deliver healthy and sustainable cities? So over to you, Deepti.
Thank you, Billie. So I'm going to focus today on the first paper in the series where we really asked the question, do we have the policies in place to deliver health and sustainability? I'd like to start by acknowledging a very international team of authors and especially thank them and acknowledge Melanie Lowe that co-led the study. So we know that we need policies in place, but quite often these policies tend to focus on downstream outcomes, whereas policies really are upstream determinants of health and sustainability. And in order to ensure the best practices, we need first policies to be consistent with the evidence on healthy cities. We need them to be clear and specific and very concise. And they also need to be aligned with specific measured indicators and also have budgeted policy targets. So we got this collaboration together as Billie spoke about. We reached out to collaborators across the world. We formed this network and really asked the questions, do these policies support the creation of healthy and sustainable cities? Our local collaborators collected policy data. They accessed publicly available government documents. And then we established this whole framework of indicators that compared not just the availability, but also the quality of policies. This framework was quite extensive, hours spent in coding. We also looked at inter-rater reliability and validity to ensure that we were being consistent in coding across the 25 cities. And of these 25 cities, 19 were in high-income countries and 6 were in middle-income countries. We established measures to analyze these 9 indicators, specifically looking at integrated planning, so transport and land use indicators, air pollution, access to destinations and employment, demand management, specifically with car parking restriction, design when it comes to open space, street infrastructure, housing, density, distance to public transport, and also investments in transport infrastructure. So what did we find? Across the 25 cities that in our sample, this was a proof of concept. So on your screen, you have a selection of our results. When we look at overall score for policy presence, Belfast and Valencia ranked quite high. This is a score out of 24. And they had quite a vast coverage of policy across the metropolitan area. Some of the US, the American and Australasian cities ranked quite low. The overall score for policy quality as well, you can see in the column on the right. So we had quite substantial gaps across the cities, across the middle income countries and the high income countries. So when we come to gaps, what we really find is some glaring gaps when it comes to health. row number 2, look at health impact assessment. So the percentage of cities in our sample that actually had a health impact assessment built into their policy was only 16%, which is a real glaring gap. There were similar gaps with street connectivity requirements, with housing density requirements, and also information on government expenditure on infrastructure for different transport modes. When it comes to looking at measurable policy targets, it is very difficult to monitor how these policies are implemented and hold governments accountable if these targets and policies are not measurable. We found that cities in middle-income countries had fewer specific and measurable policies than in high-income countries. And the percentage of cities with a measurable policy target, so with employment, you have 16%, street connectivity was the lowest at 12%, and you can see the range on the screen. So when we look at specific examples, so Mexico City had a very specific policy target with public open space, and that's 12 meters square per person. So that's an example of a measurable policy target that we had. Likewise, in Auckland had a very specific target of where 95% of the population should be within 500 meters of a public transport stop by 2021. So these are examples of some of the very specific policies that we found. Several policies were inconsistent with the evidence on planning healthy cities. And when this happens, we are in the danger of being locked into unsustainable patterns. For example, cycling participation, car parking restrictions. And if these policy targets are not aligned with health and sustainability, then you're undermining the efforts to increase physical activity and various other health indicators that we try to do. So both fields need to be talking to each other. So what we proposed was that policy indicators need to be specific and measurable, like the examples that I presented, and they need to be benchmarked and monitored to track how, as cities make these pledges to become net zero and climate pledges, how do we move forward? So we really need to strengthen policies and legislation, and these specific policy gaps that we identified should be remedied in each city. Specifically with low and middle income countries, we need to support capacity building. We need more specific and measurable policy targets that are contextualized in those countries, and they need to be informed by the evidence. And we also then looked at optimal thresholds for urban design and transport features. And with that, I will pass over to my colleague, Professor Ester Cerin from the Mary McKillop Institute for Health Research at Australian Catholic.
Thank you. So I'll start with this question. What should the thresholds for policies to create active and sustainable cities be? So to answer these questions, we estimated in the second paper of our series, and here you see the title of the paper as stands in the series, and all the co-authors that contributed to this amazing work. I'm really biased, right? So in this paper, we tried to estimate thresholds of spatial urban design transport features associated with 2 physical activity criteria. And you may ask, why are you focusing on physical activity? The answer is right here on this slide. Because a physically active population is an essential characteristic of a healthy and sustainable city. And let me explain this. So, if you're physically active, you're likely to be healthier, and nobody's going to dispute this, I hope. If you have a healthy population, you have also a more sustainable population. If you have a population that engages in active transport rather than motorized transport, you also end up having a healthier city and also more sustainable city. And this is why we focused on physical activity. So we thought, okay, in order to inform city planning policy targets, we may look at thresholds associated with 2 physical activity criteria that we thought are meaningful. The first one is the 80% probability of walking for transport. In other words, most people walk for transport. So 80% is quite a high level. And the second target was a WHO target of at least 15% reduction in insufficient physical activity by walking. By the way, the WHO does not mention walking as the only mean through which to achieve physical activity. But in this particular study, we just focused on walking, just to clarify. And the other question here is, why did we focus on walking only? You know, the physical activity is quite diverse. You have many diverse forms of physical activity, exercise, household activities, etc. Why did we focus on walking? Because walking is the form of physical activity that's mostly related to neighborhood environments. It's the one that's really impacted by it. And also walking, not only by improving walking or promoting walking, we not only increase the number of people that are sufficiently physically active, but also reduce greenhouse gas emissions by promoting active transport, right? Walking for transport. And that leads to healthier and sustainable cities. In order to address our aims, we use data from the International Physical Activity in the Environment Network adult study. This is really a study conducted in 12 countries across 5 continents. We used only 10 countries for these studies because 2 of the countries, one was Spain, did not have either GIS data that were useful for our purposes or walking data as measured by International Physical Activity questionnaire, the long form. So you see that in our study, we included 10 different countries. 7 were from high-income countries, and we had 3 upper middle-income countries, including Brazil, Colombia, and Mexico. This study focused only on adults, so we recruited adults aged 18 to 66 years from selected neighborhoods. So we use a 2-stage stratified sampling strategy to select neighborhoods from which to recruit participants. And the stratification was done by walkability and socioeconomic status. And we did this to expand the variability in our exposure in order to better assess the shape of the relationship between walkability or features of a neighborhood environment and physical activity, in this case, walking. As I said initially, we measured walking using the International Physical Activity questionnaire long form that has items assessing walking for transport as well as walking for recreation. And we measured environmental attributes of neighborhoods using geographic information systems. We defined neighborhoods as areas 1 kilometer radius surrounding the participants' homes. So to achieve the goals, we first estimated the strength and shape of the associations of 5 indicators of urban design and transport features. They're listed here, you see, with the odds of 2 outcomes: engaging in walking for transport and doing at least 150 minutes per week of walking for transport or recreation, because that's the actual recommendation by the WHO related to physical activity, right? And then after doing this, we estimated the threshold associated with 80% probability of walking for transport and achieving a 15% reduction in physical inactivity via walking. And while the first criterion is really straightforward, everybody understands when I say 80% probability of walking for transport. But when I say 50%, 15% reduction in physical inactivity, what does that actually mean? We had cross-sectional data, and someone may argue, you can't do that with cross-sectional data. What we did, we defined the target as the percentage of the sample who would meet WHO physical activity guidelines via walking if there was a 15% relative reduction in observed prevalence of those not meeting the guidelines. And what does this all mean? We had an observed prevalence of physical activity meeting the guidelines of 50.4%.
If we have actually 15% reduction in physical inactivity based on these figures, our target prevalence, omitted the guidelines, should be 57.9%. You can do the math after that, I can show you. So that the 58% target prevalence omitting the WHO guidelines was actually our second physical activity criterion. Okay, so we had to summarize, just so you can follow what I'm going to say later, 2 physical activity criteria, 80% probability of walking for transport, and 58% omitting the WHO guidelines for physical activity via walking. So let's have just a look at the descriptive statistics here. The different countries and cities varied a lot in the prevalence of walking for transport and meeting WHO physical activity guidelines for walking. As you can see, some of the cities actually met the criterion, the first criterion. They had over 80% of the sample engaging in walking for transport. And we can see here Czech Republic, Denmark, Wellington, New Zealand, then Bogota, Colombia, and Cuernavaca, Mexico. Then we had also several countries meeting the second criterion, the more stringent criterion of physical activity. Again, Czech Republic, Denmark, New Zealand, Wellington, New Zealand, and Bogota, Colombia. What about the associations? We actually find collinear associations between population density, intersection density, and the probability of engaging in any walking for transport. And you can see from this graph that according to our data, neighborhoods that are really at the low end of density would benefit the most from densification in terms of promoting walking for transport. Thresholds. So we wanted to know something about thresholds. We found that neighborhoods that had approximately 5,700 people per kilometer square and about 100 intersection density per kilometer square were associated with an 80% probability of walking for transport. But we also can see here that there was an optimal range of values associated with walking for transport, 80% walking for transport, which basically means that some neighborhoods may be actually a bit too dense to be optimal to promote walking for transport. And there may be a threshold, an upper threshold, beyond which increases in densification lead to a reduction in probability of walking for transport. So I'll just move on to the other one. Yes, what about the second physical activity outcome, which was meeting the WHO guidelines, physical activity via walking? We observed a similar association. It was curvilinear. The thresholds associated with the related physical activity criterion were different, would be higher. And I remind you, the physical activity criterion in this case was 58% of probability meeting WHO guidelines via walking. We saw that the threshold for population density was 6,500 people, approximately per kilometer square, and about 120 intersections per kilometer square in relation to intersection density. It's an interesting thing that we actually didn't find differences in the threshold values and the associations across sexes, age groups, and cities. So they were generalizable across all. Let's move on to more data related to the probability of walking for transport. We also find a curlinear relationship with public transport density with a threshold of 28 public transport stops per kilometer square associated with 80% probability of walking for transport. There was a curvilinear relationship also with street network distance to nearest public transport, but we had no threshold value related to that association. We found a negative association between distance to nearest public parks and probability of engaging in walking for transport. Again, here, associations and thresholds did not vary by sex, age, or city, which is an interesting thing. We found a similar findings in the IPEN study related to other outcomes when we use objective measures of the environment, but not when we use subjective measures of the environment. It's a kind of interesting thing. More data on correlates of meeting the WHO guidelines, physical activity via walking. We found significant associations or evidence of some associations between this particular physical activity outcome and public transport density and distance to nearest public park. As expected, the association with public transport density was positive, while that with distance to nearest public park was negative. No thresholds values were found for these environmental attributes, which basically means that having parks really in the immediate vicinity of the home and having many different types or options for public transport nearby may help us meet the WHO guidelines for physical activity walking. Again, associations and thresholds didn't vary by sex, age, or city. So that means that they may be generalizable across geographical locations, they may be generalizable across cultures, at least those that were included in the IPEN study. Now, just a reflection on these findings, what we found is that most of the neighborhoods that were included in our study would benefit from this densification. There were some that wouldn't, especially a percentage of neighborhood in Cuernavaca, Mexico, and Bogota, Colombia. They actually were on the other side of the scale, so, too dense to be supportive of physical activity and walking. But, you know, more is better is not always the most appropriate message, and for this reason, right? Because densification or already dense area may lead to negative consequences, as you know, overcrowding and pollution and noise and everything else. Oh, stress, which may actually not be beneficial for health. We have to emphasize that the right thresholds in this work are not definitive or final. First of all, we only looked at two physical activity outcomes, actually only two health-related outcomes. So we need to expand this work to other health-related outcomes. We only focused on mainly high-income countries. We had two upper middle-income countries, but they are not representative of all the cities in the world, far from it. So we need to expand this work to low to middle income countries. And we also need to include cities with higher density. We didn't have ultra dense cities in our sample, even if the IPEN study actually includes Hong Kong, but Hong Kong didn't have appropriate data for this particular study, so we couldn't include it. We didn't find differences in associations across sexes, ages, but it doesn't mean they don't exist in some different countries. There may be really sex differences in the thresholds and associations in low middle income countries or different cultures that we actually couldn't capture. So that needs to be expanded as well. We only focus on adults, and the populations consist also of youth and also older adults, and these thresholds may not apply to them. So there's a lot of work that we need to do in the future. And I think I'll do some of it, I hope. I'll stop here and I'll introduce now Carl Higgs. You wouldn't believe, he's actually still a PhD student. He's done so much work. He's from RMIT, working with Billie. That is amazing. I'm giving him an associate professorship already. So here I am. Yeah.
Thank you, Esther. Cheers. Thanks all for being here. It's great to be here in Valencia. Through the previous two talks, my colleagues have outlined our approach for collaborating with local experts to identify whether we have the right policies for achieving healthy, sustainable cities and what thresholds of urban features would be needed to achieve active living targets in different contexts. And I've accidentally changed the title of our article here to the title of my presentation. But notwithstanding that, I'm going to be presenting on behalf of my co-authors on how we calculated spatial indicators of urban design and transport features for achieving healthy and sustainable cities for a range of spatial scales and overall city summaries across the 25 diverse cities included in our study, and developed open source software which can be used with open or custom local data to generate spatial urban sustainability indicator datasets for new cities and time points. We're now planning to do this in coordination with local partners through the next phase of our project for more than 1,000 cities globally. The need to change how we design cities to improve health and well-being and equity and access to the social determinants of health has been recognized for a really long time. The WHO Healthy Cities program and Ottawa Charter for Health Promotion in 1986 had an ambition of health for all by the year 2000. But we know that there are existing and new residential developments that are still being built without provision of services, amenities, and infrastructure to support healthy, active lifestyles. Creating healthy, equitable, and sustainable cities is still a global priority, but to achieve the Sustainable Development Goals and World Health Organization health equity goals, we need evidence to target interventions, empower communities to advocate and lobby for change, and support new research that further extends evidence for vulnerable subpopulations. So this is why it's important to benchmark and monitor both whether, but also where policy targets are delivering walkable streets, well-serviced public transport, access to amenities and services we need to access as part of our daily life, as well as green space. Spatial indicators of urban design and transport features calculated at a range of scales from address points to high-resolution grids of the spatial distribution to overall city summaries allow policymakers and planners to target interventions within cities, compare performance across cities, and when measured across time, can be used to monitor progress for achieving urban design goals and for reducing inequities. But they also provide a rich source of data for those advocating for disadvantaged and vulnerable community populations to provide evidence for whether urban policies where they live are serving their needs. But the calculation of policy relevant indicators of healthy and sustainable urban environments is not always straightforward. It isn't straightforward. Often the indicators we see around are broad summary indicators for entire cities, and the assumptions used in calculating these are often obscured. And really, to make a difference, you want indicators that allow for mapping of inequities within cities so that these can be identified. You want indicators that are distributed as open data in accessible formats that can be linked to by others with additional relevant data and inform targeted plans for action for communities and localities who have specific needs. But if you're wanting to measure both within and between cities, then sourcing the appropriate data can be a challenge. For the locations where data is available, the underlying definitions and assumptions may mean it's not always suitable for making fair comparisons with other locations. And when it comes to measuring urban phenomena across a series of cities in a comparable way, it's very important to get these definitions right in a way that respects local contexts. Measuring cities in detail in a way that's both meaningful, supports fair comparisons, and with well-documented outputs to support reproducibility and generalization to new contexts is challenging to achieve and can be resource intensive in terms of technical expertise and the funding required to support this, let alone the costs for data and software. So this is particularly the case in resource-constrained contexts where measuring and monitoring may have the most impact. So through the Global Healthy Sustainable City Indicators collaboration, we proposed a new way forward to support calculation of consistent, reproducible spatial indicators for healthy, equitable, and sustainable cities. We leveraged an international network of collaborators for data sourcing and validation of our inputs and outputs. And this was particularly important because we drew upon global open data sources, including the European Commission Global Human Settlements layer to identify urban boundaries and high resolution population distribution data, OpenStreetMap for modeling pedestrian street network routing for access to services and amenities, and GTFS transport schedules for evaluating public transport service frequency where they were available. Data quality and fitness for purpose varies by location. So through coordination with our collaborators, we were able to identify limitations and incorporate ways to overcome those in our process. We developed an open source software framework to make calculating these spatial urban indicators using open data both transparent and accessible, as well as readily generalizable to new urban contexts in collaboration with local partners. So the core set of indicators that we calculated for our 25 city study using the open source software framework we developed was founded in the first instance on identification of walkable catchment areas for sample points that we generated every 30 meters along the pedestrian network in populated urban areas. For each of these sample points, we identified the neighborhood reachable within a 1,000 meter walk, which depending on individual preference and capabilities might correspond to a 10 to 15 minute walk, being the kind of walk that would be achievable for many people to do if they had somewhere to go to. We calculated population and intersection densities within each of these local walkable areas, and then evaluated for each sample point whether a series of destinations could be reached within 500 meters, a threshold commonly used for evaluating pedestrian accessibility in line with the sustainable development goals. A healthy food market, a convenience store, a public transport stop, and where data were available, public transport stops with regular daytime weekday service, as well as any public open space and large public open space. We calculated a score for access to a mix of daily living amenities and services, and used this in conjunction with population density and street connectivity to create a measure of walkability both for within and between city comparisons. And we iterated over results and interpretations with our local partners to ensure that the data, definitions, and findings provided fair representations for their local contexts, and ensuring that our framework was flexible enough to accommodate approaches to fairly represent those local situations. The resulting data sets for neighborhoods and overall cities are very rich, and we've made them public alongside our reports, so they can be used by others for a range of purposes. And one of the uses we made of it was to map the spatial distribution of walkability for the 25 cities in the study relative to the neighborhood average across all cities. So this tells a visual story, not so much about higher and lower income cities, so much as different contexts and approaches to urban planning. In general, across the cities included in our study, inner cities tended to be more walkable and outer suburbs less so. Neighborhoods in cities from high-income European countries tended to perform relatively well, but those of cities in the high-income countries of Australia, New Zealand, and the United States were amongst the least walkable overall, with these cities displaying distinct patterns of their sprawling, car-dependent urban form. So this contrast is in line with the findings outlined by Deepti, that policy targets for urban design and transport were more often inconsistent with evidence or lacking ambition for US and Australasian cities. Sao Paulo was amongst the most walkable cities in our study in terms of the indicators that we measured, and this was in line with the strong policies identified for improving public transport and pedestrian infrastructure to reduce car dependency and traffic congestion, and so could in many ways be an exemplar for many middle as well as high income settings in this regard. But there are other indicators we didn't measure. We didn't measure the slope for walkability. We didn't measure safety, lighting. So these are ways we are going to seek to expand our framework as we develop our software further. We also use the indicator data we created to map neighborhood access to areas of public open space larger than 1.5 hectares, suitable for a range of activities. And while there was less clear regional patterning, 4 of the 5 cities with lowest levels of population access to public open space that we estimated were in middle income countries, along with Phoenix in the United States. Drawing on the threshold scenarios modeled in Ester's paper, we found considerable variation between the included cities in terms of the levels of population and street intersections required to achieve. Oh, I'm talking about the next slide, but given time, I'll skip ahead to that anyway. Considerable variation between these cities. But in most cities, levels of these features were considerably lower than desirable to meet those targets. And apologies for reading from my notes, it's terrible. I'll try and do better next time. So to sum up, we developed an open source software framework, which can be used with open or custom local data for benchmarking and monitoring policy relevant spatial urban sustainability indicators in diverse contexts. We produce spatial indicators data for small area neighborhoods, as well as overall city summaries for 25 middle and high income cities, cities and high and middle income countries globally, and which we made available via healthysustainablecities.org and Figshare. The data can be used directly for mapping and reporting, but also for data linkage for further analysis, for example, as environmental exposures in epidemiological studies. Our 25 city study provided a demonstration of our approach, which is now available as an open source tool for use by researchers, community enthusiasts, policymakers and planners to create indicators of the social determinants of health for examining within and between city inequities and track progress towards achieving the UN Sustainable Development Goals. So I'll now hand back to Billie Giles-Corti. Thank you.
So the final paper in the series looked at, well, what next? What do we need to be doing, and where should the agenda be going into the future? So we've done, the first series was just on the 8 Ds, but we wanted to go one step further. And here again, we invited, Mark Neuenhausen's here, but we invited a series of other collaborators to join us because to provide additional expertise to the team to be able to write this paper. So since we published the first series in 2016, the evidence is growing. So there's much more evidence available now, and it's growing stronger because there's more longitudinal studies that are available. And air pollution is the fourth leading risk factor for global mortality. And so we know now that, you know, we need to be focusing much more on air pollution. Mark would have said that we should have been doing that in the first place. But we continue to design car-centric cities, and many people living in cities where air pollution's levels are harmful for people's health, hazardous to people's health. So we aren't really learning from the evidence that's available. We need to be acting. I know that we just got the EU standards came out today or yesterday, but globally we still have a major issue. We've got an aging population globally, and cognitive health is emerging as an emerging issue. And many of the urban and design and transport features that we've included in the series are risk factors for dementia. So this is something to be another reason to do it. And of course, cities are both the generators of carbon emissions, but also being directly affected by climate change. So this urgency for integrated, not just picking and choosing one strategy, but integrated city planning to mitigate and adapt to climate change is now becoming more than urgent. It's palpable. We need to be moving much more quickly than we've been moving in the past. Now, COVID has, thrown us some different issues that we need to think about in cities, and it's really highlighted some of the vulnerabilities in cities. So, for example, one of the things in the beginning of the pandemic, there was arguments that density was the factor that was contributing to the transmission of COVID. But actually, it's turned out that even it's crowded conditions in Australia. We've got a lot of low density housing, and where we saw the first lots of COVID cases were in the outer suburban areas where low paid workers were living often in crowded houses and sharing rooms. And as a result of that, they were the ones that were getting it. They were also moving across the city, and they're much more mobile. So mobility came out to be more important than density per se. And what we've seen in the literature is it's, many of the highest density cities were the ones that put in the public health measures that did control COVID. So I think we need to be thinking carefully about not throwing density out, the baby out with the bathwater, as people tend to say. Poor air circulation, ambient air pollution was shown to be also a factor in disease transmission. We saw, because of poorly designed high density housing, we saw though people did migrate to the suburbs, and this is a real issue because it could mean that in the future, we end up with more urban sprawl. We also saw, I don't know in other cities, but certainly in Australia, we saw that people shifted off to the regional cities, and that's put up house prices in those regional cities, and it's also dislodged many low-paid workers who were living in the inner city of the regional cities, which wealthier people tended not want to live, but it's dislodged them. There's many more people now living in caravans. It's really quite shocking to see. So, COVID did have a big impact on housing in Australia and probably in other parts of the world. We saw that people who living in amenity-rich areas with good public open space, with shops and services, they tend to do better during COVID because they had everything nearby. But we've seen in our series that these are inequitably distributed across cities. So not everyone has access to that, and that is, you know, inequitable. We need to be thinking about how we change that, and we change it. And we should not see social infrastructure as something that comes later. We wouldn't build a community without water and sanitation, but we tend to build neighborhoods without all the, you know, the basic amenities that people need for daily living, and we need to change that. We saw some positive things that came out of COVID. We saw that, you know, telecommuting, suddenly people could do it, something that many cities, places around the world, people weren't able to do, but suddenly it became the norm. We saw a reallocation of road space, something that we never thought was possible: walking, cycling, commerce, recreation. People will suddenly be able to use road space. We saw pop-up cycle infrastructure. You know, we wanted to get cycle lanes in, and everyone says we can't do it, but suddenly pop-up cycle lanes were appearing all over the world. And really, I think one of the terrific things has been organisations like C40 have committed to build back better, to create 15-minute cities, which is entirely consistent with the sorts of things that we've been saying throughout, that we needed to be creating this. But the question, of course, we think that if people implemented our framework with the 8 Ds and the integrated upstream planning, that would actually achieve the 15-minute city. But the question is, how do we optimise the 15-minute city, the compact 15-minute city? We really need to be thinking about that if we want to have equitable cities. It's not just a matter of doing it and then waiting and see, but actually carefully, I think we can be using research to inform how do we get that right. We don't want to make mistakes, because that lays down the foundations for people to live in hardship for many decades, centuries, in fact. So we need to be thinking carefully about that. So what we've come up is a new framework. We wanted to enlarge our thinking, not just to be thinking about human health, but to be thinking urgently about ecosystem health and planetary health as something that we need to be considering in the way we're designing our cities and in the way we're designing our 15-minute cities. Now, I'm not going to go through the whole framework here, but it's available in our series. What we've proposed now is we need to have 11 Ds, so 11 integrated urban and planning system policies to achieve 11 Ds. We've added in disaster mitigation. We've seen with climate change, there is many more cities being affected by climate change, and we're still building in floodplains, and we're still building in fire risk areas. We need to be mitigating climate disaster management, because we need to be thinking about where we're putting housing and stop doing this. And just before we came away, there was a flood. We have the Melbourne Cup, which is a big horse race. The whole city will close down next week on the 1st of November for this horse race. And then because they were worried about that they might get flooded because they're near the river, they put in a big wall so all the houses have been flooded. It's so controversial, but so that the floodplain is the racetrack, and that's going to bring in lots of money. So they've actually put up this big wall, and all these other houses got flooded. But we need to be thinking about, you know, protecting floodplains and allowing flood to happen, but not affecting housing. So we put that into our framework. We've also added destination proximity. We sort of talk about this, but it's very basic. If people don't have places to walk or cycle nearby, they won't walk or cycle. So we wanted to highlight the importance of destination proximity. It comes out all the time in the literature. It's a major factor that contributes to people being able to walk or cycle and to use public transport. So we've added it into the framework to make it much more prominent. And we've also added in distributed, this whole issue of equity. We cannot continue to build our cities without just making sure that they're equally distributed across the whole city. Now, we did have in our original framework a focus on housing. I just wanted to give you one pathway through which we think is really critical to think about. We said that housing was important in our first framework because it needed to be located in amenity-rich areas with higher density housing so that we could have people to walk, and it would reduce driving. There's plenty of evidence around that. It reduces driving, it increases walking, cycling, public transport use. That reduces risk exposures, and downstream it affects, you know, chronic disease. We agree with that. That's still the case. But I think COVID has really shown us that that housing needs to be both appropriate, affordable type of housing, and everyone should have access to that. We've seen that overcrowding was one of the factors that contributed to the risk of airborne infectious diseases. So we need to make sure that our housing is appropriate. And we also saw, and that's why so many people left their high density housing, because it's inappropriately designed, wasn't flexible enough, it didn't give people enough space. And that meant that people, there were people who had to stay, stayed, and there were mental health issues that came from that. People who could move, had the resources to move, moved to outer suburban areas or into regional cities because they had the resources to do that. But some people had to stay. We really need to have housing design guidelines that ensure that people have access to appropriate, affordable, well-designed, high-density housing, and that is done well. I mentioned distributed, but also what's really critical here is governance. And so we've put a really bigger emphasis on good and integrated governance. We really need to have premiers, prime ministers, presidents, mayors saying to all the departments, what are you doing to do integrated planning to achieve better outcomes in the city? That's the only way we'll actually have our cities changed, if there's integrated planning across all the sectors, vertical between different levels of government, the private sector, the community, but also horizontally across government to ensure that we have integrated planning. You know, everyone's talking to one another to produce a good outcome. We wouldn't build communities without water and sanitation. We need to make sure that people have access to all the things that they need for daily living, and that can only be achieved through integrated planning across all the different sectors. So we've got a call to action. What we've shown, as you've seen some of the evidence, that the low-income countries, some of them are doing quite well in terms of their original, the way they've been designed. But of course, rapid urbanisation is occurring in the low and middle income countries, and they don't have the policy framework to ensure that what they're going to deliver into the future is going to be healthy and sustainable. So we need to be supporting low and middle income countries and particularly disadvantaged communities to have good evidence, good policies in place and to deliver healthy and sustainable outcomes into the future. We believe that's really important to benchmark and monitor progress in cities. And we think that the policy and spatial indicators are a really good mechanism to do that. We really invite you to use the tools we've created and to expand them. We know that there's many more, and our new framework provides some clues to where we think we need to be developing new indicators, but we want people to expand the tools. We really think that cities need to strengthen policy frameworks, and not just to pick and choose, but to have all the 11 Ds included in their frameworks to produce better outcomes. And we really would like to see more evidence being used in policy making and monitoring implementation. It's good to have policy, but policy is only as good as its implementation. So we need to be, the spatial indicators are really a great way of monitoring to see what's happening on the ground for the lived experience of people living in cities. Are they getting what we hope that they're going to achieve in terms of better outcomes? And that's going to require a transformation of urban governance. We need, I mentioned, horizontal integration of governance, vertical across different levels of government, with the private sector, with the community, to be able to produce better outcomes in our cities. For civil society, citizens and the research community, we also had some calls to action. We really found that using open data was really the only way that we could have done this study. And we want to upscale that. We want people to create and use it. We want people to encourage citizen science to create these type of data. Now, for researchers, I think there's something really important to say. You know, we always say that we want policy to be evidence-based, but if we want policy to be evidence-based, as researchers, we need to create policy-relevant evidence, because otherwise it's going to be really difficult for them to implement the evidence that we're producing. So we need to be creating policy and practice relevant evidence as researchers, but the only way we can really do that is through co-design with academics, policymakers and practitioners all working together. We would like to see more policy relevant evidence-based indicators. We'd love them to be incorporated into the 1,000 City Challenge that we've just mentioned. And we really feel that there's a need to, there's any funders in the room to prioritize these multi-sector, multi-outcome, multi-country studies. I know the EU does a lot of these studies, which is fantastic, but we need them across the whole world, not just in Europe. Carl's going to talk to us about the research translation activities we've done. We'll try and get those through those fairly quickly if we can, Carl. But just to give you a sense of our research translation activities.
Thank you, Billy. So to help make our findings accessible, we created a suite of reports for each city and in multiple languages. They've been designed for local audiences whose lived experiences are shaped through their city's transport and urban design features, and to empower decision makers with the high-level information they needed to enact change. They provide a local lens for viewing the results of the Lancet Global Health series on urban design, transport and health, concisely summarizing the series' core concepts. Oh dear. So yeah, concisely summarizing the series' core concepts and provide, sorry, I've got a lag with the slides, and provide executive summaries of the findings for each city. This was meant to be like a whip through all the a series of as an example, but well, it'll go slower. I am clicking, yeah. Okay, we engage with local experts collaborating on the translation and contextualization of the reports. And this has resulted in 46 bespoke reports for each of the 25 middle and high income cities included in the study across 16 languages. This is a real pain, sorry, I'm out of sync, but you get the gist. We've created these in different languages, in 16 languages. So Catalan and Valencian, traditional and simplified Chinese, Czech, Danish, Dutch, German, Hausa, Maori, Spanish, including Mexican Spanish, Portuguese, including Brazilian Portuguese, Tamil, Thai, and Vietnamese, in addition to the English language versions created for all cities. So to support this process, again, we authored open source software, which allowed for the flexible customization of the report layout and adapting the plots, formats, and units according to the norms of the cities we were collaborating in. So this means the process can be extended for new cities and languages to produce new reports as we or others extend the study further. The included figures enable performance comparisons to be made with the median values for the 25 international cities in terms of population access to urban design and transport features, and the overall presence and quality of city planning policies that promote health and sustainability. They also provide more detailed overviews of the spatial distribution of urban design and transport features to help identify areas that could benefit from interventions to create healthy and sustainable environments, such as walkability relative to the 25 cities studied. The percentage of population meeting minimum thresholds of population and street intersection density to support reaching the WHO Global Action Plan for Physical Activity target, maps to identify neighborhoods with nearby access to well-serviced public transport and large public open space, as well as summaries of the overall percentage of population who live in these neighborhoods. And a series of policy checklists detail further insights that could inform changes needed for local city policies. The city planning requirements checklist identifies whether a series of policies for achieving healthy and sustainable cities were identifiable, with a summary of the percentage of cities meeting these objectives for the cities studied from middle and high income countries. And city-specific checklists for walkability policy, public transport policy, and public open space policy help identify where policies were identified, reference specific standards, featured measurable targets, and whether they can be considered consistent with evidence for environments supporting healthy and sustainable cities. So the study findings can be found on our Global Observatory of Healthy and Sustainable Cities at healthysustainableCities.org, consisting of a website that summarizes the work of our collaboration and includes freely available scorecards, extended reports in multiple languages, and links to all of our data and code used for the 25 cities policy and spatial study. In addition to the reports for each of the 25 cities in our study, we provide simple to use single page scorecards an infographic summarizing the key results for spatial and policy indicators for each city. So this is an example for Mexico City, the hometown of Deborah Salvo, who's the co-lead of the 1000 City Challenge and the Global Observatory. Scorecards show spatial indicators in the top part of the page, along with illustrations to communicate the relevance of these. For example, in Mexico City, we estimated that only half the population has local access to any public open space. The policy indicators are in the bottom part and include 3 simple to understand icons representing the availability of the policy, whether the policy aligns with the promotion of health and sustainability, and whether the policy has measurable targets. For example, Mexico City has parking restrictions to discourage car use in alignment with the promotion of health and sustainability, but has no measurable target for that. These scorecards can help provide a quick, simple, high-level description of the performance of each city with respect to the evidence-informed thresholds for healthy and sustainable cities. Our vision for the Global Observatory of Healthy and Sustainable Cities is that it'll be used as a tool for population health surveillance, reporting, goal setting, policymaking, practical guidance and advocacy, encouraging the scaling up of healthy and sustainable urban design and planning efforts. So we'd really like to express our gratitude to the local collaborators who assisted with applying our methods to the diverse cities studied, including Valencia, and with our translations. So thank you, and I'll now hand over to Giselle.
Thank you, Carl, and thank you, everyone. And also thank you for having me. I think I'll just sort of start out our discussion portion, if that's okay, with some quick thoughts and comments. And I just want to say that every time I hear about this work, I learn something new. I think it's such an important and phenomenal project. And I just want to congratulate again all the authors and the collaborators on the great work, because it's so needed. And you really all have achieved, I think, what many of us have thought was impossible to try to find cities, city data that is comparable, that is open, that you can actually get good quality data to look at across different cities. I think that's all of us who've ever tried to do that. It's virtually impossible to do. So huge congratulations on that. And then also the policy piece. I think finding good, consistent ways to actually measure policy is something that we talk about a lot, but is rarely something that is done. And as you talked about, I think it's very difficult when you really dig into policy, having worked with a lot of cities and policymakers, just to convince them to do one measurable goal inside policy. It doesn't happen very often. So you actually found a lot of places that you could say, you really need to measure more, but you've measured a few things and here's how you're doing. So just, I think it's overall, just couldn't say enough how important this is. Finding, all that unavailable data, you found a lot of data out there somehow. And, I think also defining the city boundary. This is something that I think is a real challenge. So you found a way to, do your very best to use one consistent definition of what the city is to be able to compare them. But I think, in the future, I know we all agree on this, the future steps and the next steps of digging in more and using this data. I think we all agree it would be great to sort of do even more in terms of looking across the different types of cities and the different similarities that the cities have, so we can maybe dig in and understand a little bit more about the way that similar cities behave and how we can actually get more from the data and the findings. So all that is to say, I think there's some things, that perhaps are not all that surprising from what you found. For example, when we talked about, the walkable cities and the cities that are doing better in so many of these measures, they're the older cities, of course, in Europe, for example, that weren't necessarily designed around cars, but were originally designed for people. And then we know that the ones that do really terribly are a lot of the ones that were designed for cars. So maybe that's not surprising, but it's still good to have that data. As you say, if you can't measure it, you really, you don't know that there's even a challenge. So it's a great and important first step. But, we do need more. And I think one of the key areas, and I know you've addressed this, and I know we all feel similarly, but one of those key areas also that seems to be missing is the low and middle income country context, right? So we know that there's a lack of adequate density, for example, in so many of those low and middle income countries that are growing the fastest. Sometimes, when we find the results of some of this around too much density, I think, oh, but come on. How many places is that really a problem? Like, couldn't we be focusing more on getting the data and learning from the cities that we know have really great challenges? So I know that's something that you all are thinking about too, but it would be great to see more low and middle income countries, I think, in the future. And of course, that comes with the challenge of getting the good data and getting the boundaries, but you've taken a big first step at that. And then also, I think that, so for me, there's a lot that you could do in terms of maybe getting some cohorts together. I guess I kind of have some challenges for us for the next steps. Thinking about how the cities that are more similar, maybe we should actually get them together to talk about the challenges that they have in common. I think when I heard Esther talk about this in Brussels recently, we were talking about some smaller cities in Switzerland versus like some places in New Mexico, like Phoenix or other places in the US. And I thought, these are totally incomparable cities, right? You did your best because you were using the definition of what a city was and the data that was available to compare, which is already such an important first step. But couldn't we do so much more if we got the Western US and the Australian cities together that are really facing similar challenges, and they could talk about, what they could do better in a way that is maybe different than just comparing them to a smaller city in Switzerland that was designed in a completely different way and has totally different, a different population and different context. So I think that's something that I could see in the future. So I have some sort of challenges and ideas. And also I think that ISUH could help. So if you think it's interesting, maybe we can talk about it. How do we get, for me, one of the biggest challenges, and Carl really put it out there, the open source data that you're creating and the software that you're creating, so important. And also the city, the scorecards that you have, the different ways that you're showing cities how they compare and how they could do better. I think that's so important. But how do we get the people that are making the decisions that make the biggest impact in cities? How do we get them to actually care about this stuff? And it's so hard. I mean, we look every year for a city to host this event, for example, and it's really hard. We look for great mayors who care about this to come and to speak and to inspire all of us. And it's really hard. I mean, every single time, I think we're going to have all these great, policymakers and decision makers who obviously care about all the ways we can support urban health and how we can create built environments that support and promote health and well-being, because we have all this evidence, we know this and we're talking about it all the time. But the cities that really get it and are pushing it forward, I think they're few and far between. So one of my big challenges for us in the next steps is, and for you all to think about, is how you can get all those great scorecards and all that great, the open data software that you're creating with the indicators. How do you get people to actually care about that, who are making decisions that can make a difference? Having worked with a lot of policymakers, I just don't think that they, how can we get to that good governance piece that Billie's talking about? That's a big step, actually, because nobody really gets it right now. I mean, I say nobody, but it's just very few. So I think that's one of the things that I'm wondering about how we can do. And maybe, you talked about C40 cities. C40 cities is so great in many ways. And one of the things that they do is they actually have ongoing discussions and relationships with cities, and they can compare and exchange ideas, and they can also sort of work together to meet some of these targets. So I'm wondering if that might be something that you consider moving forward, is how you actually can engage and build relationships with some of these cities that need the information that you have and that probably aren't measuring enough and aren't putting enough measurable goals and indicators in their policies. How can we work with them one-on-one? How can we exchange ideas? And how can we also, I would say, also encourage? So that's also part of my challenge here, is that this data is really good and important. But in some ways, I feel if I was a policymaker, I might be discouraged by some of it, I'm not doing as well as Switzerland, but I'm Phoenix. I mean, how can I do better? right? So maybe we can also support and encourage the cities by saying, you know what, you're not meeting the targets right now. You're not doing as well as some other cities, but you know what, maybe you also have different contexts than some of the other cities. We could start from there together. And maybe, you know, with all the great expertise that you have and that you've pulled together for this and from everyone who's attended this conference, maybe we can actually offer some support, some technical assistance. We can really help people and cities to get there. Because I think that is what's needed to get to that next step of how do we get to that good integrated governance? And it's not magic, right? And I know we all know that, but that's something that I think cities really need our help with. And you've made it, you know, really available. And the scorecards I think are so excellent. But can we get some cities together? Can we get some people, you know, some cities that are designed similarly, maybe around cars who have similar challenges that have big sprawl problem. Density is not their problem. We really need to encourage density there. But they weren't designed like a walkable city in Europe. So how can we start there and offer them some technical assistance, some guidance, and also show them the benefits? Because again, we always talk about that we want evidence-based policy. We want it to be evidence-based, but policymakers generally, and I don't even just mean mayors, I mean everyone who's working in government as well, because that's another piece, right? You looked at policy, which I thought was so great, but policies change frequently, right? Every new mayor, every new administration wants to put out a new city planning policy, a new city planning strategy, but we could work with the people that actually stay over time, maybe, to actually help them understand why it's important and to get policies that are consistent in that sense as well. So anyway, so that's sort of my biggest challenge is how do we get all the good data and information that you've created into the hands of people who can actually make decisions to impact people on the ground, and how do we make them care? And I think we have all the data and information to do that, but maybe we need a coordinated effort to actually bring people together, encourage them and say, you know what, you're not doing that well now, but you could do better. And here's why you should do better. And I think we can do that. So also, you know, ISUH, we have this huge international network. And I think that's our greatest asset is that we have people from all different places around the world who are living these different experiences. And maybe we can create some little city cohorts and we can start to train people who are going into city planning. So that's something that we're already thinking about doing at ISUH. And this could be sort of a great entryway. So thanks for having my comments. I'm sure there's many more from the audience, but just some initial thoughts.
Okay, I just would like to respond to that because I think it's a really good point. One of the things we did, and that's why we need local collaborators. I don't think just generating data is the solution. So we have collaborators in each of these cities, and each of them, what we've been doing is building their capacity to go and do local launches of the results with their policymakers. Now we've done that, I think, in 8 of the 25. What we've learned, actually, one of the big lessons that we've learned is if you have someone who says, well, I'm going to do 3 cities in Europe and they live in Sydney. I'll give an example. There's a concrete example. Well, nothing happens in those cities because they don't have the local contacts. But for the cities where we've had people who have really been invested, who help with the collection of the data locally, they've gone out and taken these results and had sessions with their mayors or their policymakers to be able to do it. Now, to be honest, I don't think any of this is easy. And I don't think we know what to do. I don't think they know what to do either. And I think this needs to be a partnership. What I love about the work I've done with policymakers and that what they've liked about working with our team is that we've actually listened to what they're doing and I try and work out how can we help. I know what they want to do. How can they do that? Because most people know that they have to change. So it's really, and I think we have to not be so arrogant as researchers. We have to actually really listen to the challenge. One of the things when I did a literature review about working with policymakers is you have to be benevolent because they're trying, like, for example, we've just tried to change densities in Australia, in Melbourne, and well, the development industry pushed back. Well, they used our evidence to push forward, but they haven't gone as far as I would have liked. Now, I could be in the media telling them they've done a crap job, but actually I know, and I knew that they knew our evidence and they really appreciate, because they're all the people in the people that you're describing are the ones who are the policymakers. They're really pushing to change and they're up against it all the time. That's why we need advocacy. You need to be in the, I suppose they like it and you're in the media speaking about these things because but in partnership with them. So they give you information, you go into the media, they like that. So I think it's really about us, the way we work. And I really like your idea about ICU helping to bring together cities. We are working with C40 and we're hoping that, and that might be a vehicle, but I do think that there's an opportunity there for the ICU to play or ISU to play a really important role in that, because you can't do it. I think researchers just can't do it by themselves. It really needs to be but I think we need to train ourselves to work better with policymakers to work out how to solve the problem, because it's not easy. Sorry. So anyone else like to respond? Yeah.
So by background, I'm a psychologist, and we've done a lot of, studied behavior change. Behavior change, if you're thinking about individual, physical activity, tobacco, smoking, etc., requires a lot of effort to change. I mean, we're talking here about policymakers changing their behavior and changes policies, changing their attitude. And first thing, obviously, we're trying to do is make them realize there's a problem. If you don't know you've got a problem, you're not going to do anything about it. And so, the scorecards, etc., identify the problem. As everyone were aware of that, and we weren't aware that something, that can be done. And maybe, well, I think there's a lot of work to be done in this field. Then we might have to think about developing a taxonomy of behavior change, methods and that are really more focused on policy making. That's something that's been done in clinical work, in clinical psychology to change behavior, but we actually need to also think about approaching that in a similar way, I think, because we're talking about individuals and really quite a few that make decisions. And thinking about how we can impact on those as an important issue. I don't think much work has been done in this field. Yeah.
So I do wonder, do you think actually in terms of that they actually need the community to come along board too, because the politicians tend to do what the community wants. So it's really about educating the public about it, because a lot of policymakers know we have to change. It's just that they can't bring about change if the community is not behind them. Perhaps if we can open up for questions now. If people got questions, one down here. There's one just down here, and then there will be another one there. Oh, sorry. Okay, go ahead. Yeah, go ahead. And then we'll come down to you. Sorry. You'll be next. Oh, okay.
Thank you. Hi, thank you so much, panelists, for this incredible work. I have a question about the role of the research potential of dissemination and implementation sciences in this area. Just now, what you mentioned about educating the public, there's, the auto industry has such a foothold on even just dominating car-centric values among the general public, from my experience, and even just the multi-sectoral nature of this work. Transportation industry just doesn't think the same way as health sector officials about some of this. And even some of the policy challenges that Giselle mentioned, of like even just the sheer turnover of local champions and the ability of research to identify policy windows. Is it worth it for researchers to be in the D&I space? And if so, what are the gaps? Are they funding? Is it, lack of awareness?
Anyone want to tackle that? I mean, I think you've really hit the nail on the head. That's a bit like the food is, we want to change people's diet, and yet we allow advertising of unhealthy food. It's the same issue. But I think, that's why it's so important. What we've tried to do, where we had Chennai, Deepti might want to mention, but we had the cycling mayor, who is an advocate, and he's taken the evidence and he's putting the energy into it. I think in terms of putting teams together to work on the 1,000 City Challenge, what we're proposing is we need to have an advocate, policy person, a spatial person, and a policy maker, at least, to form the basis of the team to start to work on this, because unless you've got that, it's really hard to do it. But you're right, there's these other forces at play where we need advocacy around the industries in the same way that we did with tobacco, in my opinion. But Deep, did you want to just mention about?
Sure.
Chennai?
I really think that question was hitting the nail on the head. From my experience working in the Global South, there is a huge time lag from the release of evidence to actually communicating it and then seeing, action down the line. And it's how do we reduce that gap from the time we have this data to actually seeing change on the ground. And D&I science, I think, we lack capacity, we lack skills on the ground, and especially in contexts which don't have funding, which don't have the money to make that kind of change or even start thinking about it. There was one key point that I highlighted, the lack of health impact assessment policy. I mean, there's only 16% of cities in our sample that actually had some mention of health impact assessment. And in cities like in Chennai, in our sample, the city council, the mayor's office, they have a planning, vision, but they had never thought of including health on that. So I think it's a lot about starting at the grassroots level, and also it's a top-down and bottom-up approach. So it has to work in both directions.
I think Rolf had a question there. Yeah.
Thanks. Look, this is brilliant stuff. Really, really great. I had a couple of questions which relate, I think, to what we've just been talking about. One of them was, there are a lot of people in outer suburbs of car-dependent cities, as in New Zealand, Australia, the US, Canada, who are quite happy in those areas. They're really, they're happy in their car dependence. They sort of have a vague sense, I imagine, that climate change is an issue, but their future is one of technological saviors, and moving to the electric vehicle, for example, or a more efficient car, which consumes less fossil fuel, and perhaps downsizing the number of cars a little bit, getting an electric bike, but they have a vision of how they will adapt, and it's probably way too slow. But how do you persuade people like that actually there's another way of living, and another sort of city form that can be, evolved towards quite rapidly. In other words, how do you shift that whole mindset in this?
I often hear actually people say, that everyone wants to, in Australia, with the quarter acre lot. But when we ask people, and we've done it in 2 cities now, about where they would like to live, people would like to live, 66% of people would rather live near shops and services than to live in urban sprawl. And one of the big challenges they face when they live on the fringe of cities is they're spending hours in their car. They don't realize that when they buy their house, that they're going to have to spend hours driving. So it's going to be interesting with the pandemic. Now more people are working from home and post-pandemic, and whether that stays. But the 20-minute neighborhood idea or the 15-minute city idea still becomes really important, because if people are working from home, there's going to need to be shops and services nearby. They've started to appreciate their neighborhoods more. How you retrofit is like, oh my God, that's so expensive and hard. But we did just if you're interested on our website, we did a documentary. We had a young documentary maker go out and interview people. And what's sad for me is that people go out there and they buy these houses for aspiration, and then they spend hours in the car. And one of the things that, this lady said, she said, we now regard time in the car as couple time, because it takes us 2 hours to get to work each way. And that's couple time. I mean, to me, it's tragic. So I think there's lots of aspiration. I don't know. I mean, people buy what they can afford. And I keep on saying, that the most expensive places in our cities are the ones that have got the most amenity. And there's a reason for that. And that's because people want to live there. I don't think that people should have to live in neighborhoods without basic everyday infrastructure. They should be able to walk to shops, services, and that requires money associated with it. We're just trying to work out at the moment, how much will it cost? What are to deliver we call it 20-minute neighborhood. and which has the butcher, the baker, the candlestick maker, all these destinations. Each one of those has a different population catchment. What does the densities need to get to in order to be able to deliver that within a walkable catchment? So and then what will it cost? So we've just worked all of that out. We're just about to publish a paper on that. Because again, it's this how. That's what I mean. It's not easy doing this. It's easy to say everyone's getting it wrong, but gosh, how you turn the ship around is really challenging. And they really like it when you can produce them, give them evidence that really speaks to the problems that they're tackling. They like it, and they've helped us. They've provided with evidence. I mean, anyone else like to respond?
If I could just add to that, I couldn't agree more. I think it's all about the amenities. And I do think that a lot of people during COVID, myself included, I couldn't have appreciated my neighborhood more during, when I was working from home for almost 2 years. All of a sudden I was able to spend time in my neighborhood every single day. And in fact, that was the only option I had. And I happened to live in a place with every single thing within a block that I could ever want. For a while, it was closed in the pandemic. And then you really notice. But then when it opened up again, you realize, wow, this is such a privilege. I mean, this is worth every single penny. But I do think, as Billie said, it's not easy. So not to make like the hardest thing ever, bring it to the fore, but you mentioned affordability, housing affordability. And I actually think that that's kind of where, in my perspective, where we need to go is we need to have these mixed income communities where you can access every single amenity that you need within walking distance. But what I realized during COVID, a huge amount of my neighborhood in New York City and Brooklyn, they left for the pandemic. Very few people were left, me and a few others, and then the people who were running the shops and the amenities. But those people, for the most part, they didn't live in the neighborhood.
No.
So that's why so many of them closed for such a long time. And then we had nothing. But we really, I think the goal for me, and again, it's probably the most impossible goal of all of them, but if we can actually start to create 15-minute cities or 5-minute cities, as I was just in Galicia in Spain, and everything was 3 minutes away and it was amazing. But if we can create places where we can actually get to every single thing that we need, of course, that helps us build community and all the social aspects that come with that, but also just basics. If you're working from home now, you have to get to everything, but you need the shops and amenities right there in your neighborhood, which means everybody has to be able to live and work in the same space. But so affordability, I think, is actually probably the biggest thing, because as you said, people buy where they can afford, which in many, many places is outside the city center with no public transportation access. And that's kind of how the cycle happens. So if we want to create truly 15-minute cities and neighborhoods, don't we need to also think about how everyone can afford to live in the same neighborhood? It's like impossible, but I think it's the thing.
Well, we've worked out the
next.
cost. Well, I mean, I think that's the thing is we're actually working out the cost of that. It's costing, I mean, for a 20-minute neighborhood, which is actually a 10-minute neighborhood, 10-minute walk there, 10-minute walk back. It will cost, we've worked out $1.6 billion just for the amenities to build for 60,000 people. And that's that's 1.8 billion if you build it to 15 dwellings per hectare. If you build it 30 dwellings per hectare, it's 800 million. That's why density is so important. And it just does, and the density, to get the densities right, it's not like everyone needs to live in high rise. What the densities that Esther's talking about, these are, I think in hectares, 25 dwellings per hectare. It's not very dense by international standards at all. This is much denser around here. So, I think we just, that's I think the research is needed to how do you optimize the 15-minute city? There's so much work that we need to do to actually understand how we do that and do it in a policy relevant way that can really inform how we move forward, which is really critical to do.
But I think the key thing too, though, is that developers operate on such a small margin that it's really hard to convince them. But there are a few examples of mixed income communities and neighborhoods that have worked and that have actually, basically the higher end, more expensive properties actually subsidize some of the others. And so it doesn't look like, it's not like what we had in New York for a while, which was like these big high rises that had to have affordable housing units. So they had a pour door. I mean, that's not what we want, but there are a few examples. But I think we have to be talking to the developers who are actually building these places, because they're the ones who say, everything has to be luxury. And we're seeing that in most cities. And I think it's pretty tough.
Yeah, it's bad. Well, I think that was a really short discussion, but I hope, interesting and fruitful. I really thank you for coming. I know it was a big night last night and you were here, you get your gold star. So thank you very much for coming. Thanks to the panelists and thanks for Giselle in particular for being our discussant. We'd very much like to welcome you if you're interested in joining our 1000 City Challenge. We think it's really exciting. We hope you do too. And if you'd like to join up for that, please come and see us. But thank you for coming, everyone.